Dr. Shavitz, let's go into a topic which, stays right there with the children. Well, not really, but it starts there. Very young, we learn how to brush our teeth. Correct. And yet, there's millions of different opinions out there. Soft, hard brush, up and down and sideways and oval and circles, what toothbrush to use. I mean, obviously the toothbrush companies, they make us believe they solve all the problems with it. And all those things. What angle, an electric brush versus a not so electric brush, different flosses, different mouthwash. Give us your viewpoint of how much do we really need to pay detail to those details, and what is the overlaying big factor which we should be taking care of?
Yes, this is an interesting topic. Often patients bring this up. And the answer has changed over the years. I'd say the past 20 years since I've been a dentist, I learned one thing in dental school and then was preached something else and then was preached something else. Today, the latest version of this answer is I like my patients to use a soft toothbrush.
Okay.
And brush for approximately 2 minutes. Just gently brush. And you brush your entire teeth and you brush up to the edges of your gum. Okay.
And in which direction, not all that important, as long as you go about it?
It's really not that important. The only thing I don't like is the shoe shine technique, which is the back and forth. So I tend to prefer circular and up and down motions. Okay. And personally, I prefer to floss first and then brush. Too much damage is done with heavy brushing, electric toothbrushes. They're vibrating at 2,000 cycles per minute, and the patient is doing the shoe shine technique at the same time, and it's a hard bristle. They brush away their gums, they cut holes in the sides of their teeth, things like that. So we'd like to avoid
But wouldn't lots of brushing, I mean, we grow up, you just said it before, children go learn brushing at the extreme young age, get used to it, brush, 3 times a day, after every meal, at least twice, all that type of stuff. Well, and then we go to the dentist, and we have all this all this plug build up. So wouldn't lots of brushing be a good thing? I mean,
yeah. Actually, there are really 2 uses for brushing. There's only 2 things that brushing really do for you. One, they remove plaque. Plaque is that creamy white film.
I always thought plaque was the hard.
No.
Things which the dentist kind of, he with his whole shoulder, he goes in and he cracks it off.
You're a nightmare. No. Plaque is the soft, creamy film that builds up on your teeth. That's basically a matrix of bacteria, okay? That's really what you're removing. You're not removing the calculus. What you're talking about is tartar or calculus. That is almost like cement. Only your dentist is going to get that off, or your hygienist.
But with good brushing, obviously it builds slower, that cement stuff.
Yes,
right?
It does. So if you're really rigorous with your brushing, the tartar, the calculus, the hard stuff will take more time to build up. But it's almost inevitable that it will build up. I've seen patients who are really fanatic with their brushing and it still builds up. That's why you really need to come in on a regular basis to have that removed professionally.
That's interesting to know, because I do think, well, I mean, I'm only speaking from me kind of like, and looking at my wife who, she brushes a lot more than I, and she does have less of that, even though maybe that may be genetic. Some dentist once told me, put some light on it, he said, I have lots of saliva. And he said, that's good, because it's healthy overall, but it has a small side effect. You're building plaque more easy. And if then on top of it, you're lazy with brushing and all that stuff, as you are, that's why you have to come every 3 months. Done. Now, anyway, the point is, what you're saying here is that no matter how hard you brush, you're starting going more into hurting the teeth rather than avoiding that little bit of build-up, which will build up anyway. Is that what you're saying?
Correct. So you're really achieving 2 things with your brushing. Number 1, you're removing the plaque. It's very, very important you remove the plaque, and you remove it regularly. Don't let it sit on your teeth for more than 24 hours, because they change, the pH changes, the type of bacteria inside the plaque changes. You start to affect demilitarization of your teeth, and that's how you end up with cavities. Then the other thing
That's why you shouldn't have children sleep with the milk
Oh,
bottle or the orange bottle, right?
Absolutely.
That's the same reason, right?
That's the opposite. That's the opposite of what we want.
Yeah.
Then the other thing we want you to do is to brush with a fluoridated toothpaste. The delivery of fluoride is probably the second most important thing that you're doing when you're brushing your teeth. So you're really doing two things. You're removing plaque and you're coating your teeth with fluoride. You're remineralizing your teeth and rehardening them and giving them that little armor plate so they can face the next day's adventures. You're not removing stain when you're brushing your teeth. The stain is really embedded. You know, if you look at your teeth under the microscope, you'll see it looks like the surface of the moon, like Swiss cheese. And your coffees, your teas, your day-to-day, your cigarette smokes, your cigar smokes, they embed themselves within those crevices, and the bristles of your toothbrush are wider than the crevices within your teeth that take on the stain. So you're really kind of wasting your time if you're thinking that you're brushing away stain. You are not doing that. The other thing I feel is useful in brushing your teeth is also to brush your tongue. Make sure that whenever you brush your teeth, brush your tongue. Your tongue is the repository of a huge amount of bacteria. And if you can brush your tongue and go as far back as you can, you don't have to be choking. Some people are gaggers more than others, but brush not too hard. You don't want it to bleed, but just brush nicely, remove a lot of the load of the bacteria. You keep your breath fresh, and you also lower the bacterial count in your mouth, decreasing the chances that you will get cavities and even gum disease. The bacteria is associated with that.
I lived a couple of years in India, and they used a tongue scraper. Would you say that it doesn't matter what you use, just use whatever feels better for you, a scraper or the brush?
Yes, tongue scrapers work well. But you know what? You don't need to get more paraphernalia. Just use your toothbrush.
Yeah.
It works very, very well.
Yeah. Great. Good news. Thank you.
You're welcome.